Good evening and welcome to Get the Facts. What must change to get more people vaccinated? For this program, Black Doctor has partnered with AARP to talk about COVID-19 and the vaccine's impact on the older members of our community. Additionally, this program will focus on the Gulf Coast states of Alabama, Mississippi, and Louisiana, an area of the country where vaccinations have lagged behind the national averages. We have representatives from Alabama, Mississippi, and Louisiana joining the program, answering questions to help you make informed decisions for you and your families, and to tell us what needs to be done to increase vaccinations in the Black community. Our panel of healthcare professionals will break down the virus, vaccines, and treatments available. But first, we now welcome Mr. John Kane, II, Regional Vice President for AARP.
Good afternoon.
Good evening, Mr. Kane. How are you?
Well, good afternoon to some and good evening to others. I want to welcome each and every one of you for being here with us today. I now want to ask you to take a moment and imagine living in a country where African Americans, Black folk, make up 12.5% of the population. Next, imagine living in a country where African Americans account for more than 15% of deaths since COVID-19 pandemic began. Then finally, imagine living in a country where African Americans, Black folks, all over the United States accounted for 19% of deaths related to COVID-19 in May of 2021. So please take a moment and let that sink in and let your imagination take charge. Now, as alarming as this information is, we must remember that those percentages, that data, represents real people, real Black people, young and old. Well, imagine no more, because the Centers for Disease Control and Prevention, CDC, reports that everything I just said is a fact and not our imagination. Again, thank you all for joining today. We have a lot of good information to share. I thank the healthcare experts who will discuss the details and the pressing issues related to COVID-19 and vaccinations. I, along with my colleagues, especially those from the great states of Alabama, Mississippi, Louisiana, and the entire South region, humbly represent AARP, which is a nonprofit, nonpartisan organization that empowers people to choose how they live as they age. Again, thank you for joining us. Thank you for your participation. I am John B. Kane II, Vice President of your AARP.
Well, thank you so much for those wonderful opening remarks, Mr. Kane. We look forward to speaking with you later in the program and finding out more about what the AARP is doing to combat COVID and get more people vaccinated here, more Black Americans vaccinated here in the country. So thank you again, and we look forward to speaking to you later in the program. Next up, I'd like to bring on a person that is not a stranger to Black Doctor, and she has been really in the heart of this fight against COVID. She is Dr. Melissa Clark, and she is an author and a Harvard-educated emergency medicine physician with over 20 years experience. Dr. Clark is a regular contributor on CNN. She hosts a program called Excuse Me Doctor right here on blackdoctor.org every Monday night at 9 p.m. Eastern, just a shameless plug there. And she is a founding member of the Black Coalition Against COVID. So I want to welcome to everybody, introduce to some, welcome to others, Dr. Melissa Clark. How are you doing this evening, Dr. Clark?
I'm doing great. Ellis, thanks so much for having me on for this important audience and this important topic.
Absolutely. And I'm looking at some of these comments, and people are watching from all over, not just the 3 states that we're focusing on, but we've got folks from all over the country and all over the world. I saw somebody from Sierra Leone watching. So
Wonderful.
this is a worldwide conversation, but we're going to focus on our biggest three states that we have scheduled tonight. So here's the first question. I know most recently the biggest thing in the news is the Delta variant. Of the coronavirus. Can you give us some background on what the variant is and what impact has it been having on the global fight against COVID?
Absolutely. Well, I first want to talk about where variants come from. What are they? So, to understand that, you have to understand how COVID or any virus needs a place to live and a place to make more little baby viruses. And that basically is your body. And so when a virus gets into your body, it gives instructions to your cells on how to make more of itself, how to make more viruses. And in that manufacturing process, mistakes happen, changes happen to the original strain of the virus. And so what comes out on the other side, the new viruses sometimes have some changes in them. And those changes or variations are what give rise to variants. Now, sometimes those changes have absolutely no effect at all on the ability of the virus to infect somebody else. But sometimes, like with the Delta variant, it can cause the virus to be more infectious. It's easier to spread. And also, in the case of the Delta virus, appears to make people sicker. So, more people who get exposed to the Delta variant are getting hospitalized. And we're seeing that even in people who've had COVID before, who are unvaccinated, and of course, who are unvaccinated who've had COVID. So, or those who are unvaccinated who haven't had COVID. And so we're seeing, for example, there was an office building in Florida where 6 people in the IT department were exposed to COVID. 5 of them ended up very sick. 2 of them died. The one person who, and it was all with the Delta variant, the one person who did not get sick, never even tested positive, who was in the IT department, was the person who was vaccinated. And so that is one reason why it's important to be vaccinated to protect against these variants, which can continue to pop up, especially in unvaccinated populations.
Well, that's a great explanation, and that's good to know that those vaccinated people are protected. Because what I've seen recently on the news sites like CNN and whatnot, that they've called this Delta variant COVID on steroids, and so
Yeah.
because of what you're just talking about, because of how easily it's contracted and it's having a more devastating effect on the body. When you hear that, should that change how people view and approach vaccinations? You just gave a great example of how the one vaccinated person was pretty much protected even from a deadly variant like Delta. Should this help people move more people towards getting vaccinated? Hearing that?
Hopefully so. The other thing is there is some research that came out of London or out of the UK, where the Pfizer vaccine and the AstraZeneca vaccine are being used. Now, we are not using the AstraZeneca vaccine in this country, but I mention that because in the UK they are. And they looked at how effective those two vaccines were against the Delta variant and found that if you've had one vaccine, they're only about 30% effective. But if you've had both doses of those vaccinations, they're very effective, close to 90% effective. And so that's another reason to not just get one dose of the Pfizer and Moderna vaccine, if those are the ones that you're getting, but to actually get both doses. The other reason why it's important vis-a-vis the variants to get vaccinated is you don't want to be that person in whom you get the coronavirus infection and a variant pops up in you that then, like the Delta variant, is more infectious, can harm more people, and even the concern is there might be a variant that one day pops up that the vaccine can't take care of, that the immunity that you get from the vaccine can't take care of. And so that's why it's important to vaccinate as many people as possible, as soon as possible, to prevent the spread of the coronavirus and more variants popping up that we might not be able to have a solution to.
So I want to make sure that I'm clarifying this for myself and for the people that are watching. If we're unvaccinated, we basically can are potentially a virus factory, where
Yeah.
if we become infected, that virus continues to replicate. And in that replication process, it can create a variant. And then that variant can either be innocuous, which means it's not harmful, it's
Harmless. Yeah.
just a bad variant, or it could produce something like the Delta variant that is stronger and more
Right.
dangerous than the original coronavirus. Okay, got it.
Or worse than the Delta variant, because
Or worse
the
than the Delta.
vaccine can manage the Delta variant, but a variant could pop up in somebody who's unvaccinated that will infect other people who are vaccinated, and the immunity that they have won't be able to contain it. So that's why, both for people who are unvaccinated and for people who are vaccinated, it's important for you to not be the weak link in the chain of protecting everybody else. Because I say it's like we're forming a human chain by linking our arms together. And if your arms aren't linked, that means that people behind you who are more vulnerable, who you're supposed to be protecting, the children who are unvaccinated, our elderly, people with HIV, people who can't get vaccinated for other reasons, we're not able to protect those if you're not vaccinated.
So it was an interesting question that got put into the comments, and so I'm going to address it a little bit. I'm not going to put the whole question out there, but basically, the question is about, if you're vaccinated, even if you're fully vaccinated, can you still get COVID?
Yes, you can still get COVID, but I'm going to give you another example. There was a cruise ship, 500 people on board plus crew. 95% of the people were vaccinated. The 5% that weren't were children who were ineligible to be vaccinated, and they had to have a negative COVID test to come on board. They cruised the Caribbean. They came back. 2 people tested positive for COVID. They were roommates. Neither of them had symptoms. Now imagine if that cruise ship had gone out last December or even last August, what that picture would have looked like.
Right.
So no, the vaccine does not provide 100% protection. We know that it's around 90 to 95% for the vaccines. However, they provide protection. And if you do get exposed to COVID, you have either no symptoms or a much easier time than had you not been vaccinated.
Right. And I think that's important. It was a great question. So thank you to the person that put that in there. But I think it's an important distinction to make, that the vaccine does not prevent you from contracting COVID. It just helps lower and basically you could be asymptomatic if you're vaccinated and you do come in contact with COVID. We do still have to be careful because you can still pass it. I know that's a piece too.
But it lowers the risk of spread as well. So together, if you're in a crowded place, together with a mask, that's cuts down vaccination plus a mask, crowded place, very low risk of transmission.
Absolutely. So with all that being said, we talked about, you gave a wonderful story about the one person that was vaccinated, coming out of a bad situation. We talked about a cruise ship that could have been, and we know about what happened in the early stages of the pandemic with cruise ships and how they got stranded out on the ocean because so we've heard about those stories. With all of that going on, why do you think people are still more concerned about the vaccine than contracting COVID?
I say that there are really, 3 huge reasons. One is our historic mistrust of the medical establishment because of what we know has happened to African Americans in the past. We've of course heard about the Tuskegee experiment where treatment was withheld for syphilis. It's not that syphilis was given to people, as well as other medical experimentation on Black people, not for their benefit.
Right.
The other thing is current mistrust. When we go to the doctors now, sometimes we might run into healthcare professionals that seem to disrespect us or actually disrespect us and talk down to us and don't take enough time with us. And it has resulted in worse outcomes for African Americans sometimes within the medical system. So those things have turned us off. And finally, and also access to care, being able to have a doctor who you trust, who you can ask your questions to.
Right.
And in the absence of that, here you have this 9,000-pound elephant in the room of social media, where given the fertile soil of
Right.
distrust that we already have, here you have social media coming in and putting seeds of doubt, seeds of misinformation, seeds of disinformation, which is actually lies,
Right.
into this fertile soil of distrust. And it's no wonder that we are skeptical. The other thing I wanted to mention too is, our bodies are the one thing as Black people that we have autonomy over. And I think for some people, they're just like, look, I'm drawing the line right here. I'm not taking the vaccine.
Right.
But I say to all of that, it's important that we look at the facts and understand this is a worldwide pandemic. This is nothing that specifically is targeting Black people. Even in the United States, over 350,000 white people have died of COVID, right?
Right.
And so we know it disproportionately affects us, though. And so it's really important to consider getting the vaccine, because we're seeing now, after 6 months and 320 million doses given, that it is truly cutting down on the pandemic, its effects, the deaths, and the infections.
Absolutely. So I think, so let's address some of the kind of myths and that misinformation and disinformation that has been floating around on the internet. So we'll do some rapid fire questions because I want to keep us on time. Does the vaccine make you magnetic?
No, it does not.
Does the vaccine affect fertility in men or women?
No, COVID affects fertility in both men and women. It lowers sperm count. In men, it can potentially cause erectile dysfunction. In women, it has led to preterm labor and pregnancy complications. Pregnancy is a risk factor for having worse COVID-19. The vaccine does not affect fertility.
What about if they're on other medications, diabetic medications, hypertensive medications, any other medications, if they're in treatment for cancer or anything like that, can they still be vaccinated?
Yes, absolutely. Underlying conditions like the ones you mentioned, including sickle cell, HIV, autoimmune disorders, all those things are not reasons to forego the vaccine. They're actually reasons to get vaccinated, because when you have those underlying conditions, you are at increased risk for getting hospitalized and dying from COVID-19. The vaccine provides protection against that.
Absolutely. Okay. So with all of that being said, we're wrapping up here with Dr. Clark, who's doing a great job of explaining and breaking down the vaccine and the impact it has on the body. With all that being said, the last thing, elephant in the room, is how quickly the vaccine was developed. And that's been a big concern, because we say, look, typically, and I'm using air quotes, typically the research and development process of a new medication takes years to go through and get approval or even emergency use authorization by the FDA. This was less than a year. How can we get people to trust the process, that there were no steps skipped, and that this vaccine that was created relatively quickly is safe for them to take?
So we know that the platform, the technology that's used for this the vaccine, the COVID, Moderna and Pfizer vaccines, and the Johnson & Johnson vaccine were 10 years or more in the making. And so there was nothing rushed about the technology to develop it. And it just needed a specific example or usage reason. And so when COVID came along, it was clear that they could use the genetic material, the blueprint for how to make more viruses, and marry that to the technology, which had been a long time in the making. There were no steps skipped in the testing and development process. And for all vaccines that have ever been created, all the side effects that we see come up in the first 2 months. And so again, we've been at 6 months for the Pfizer and Moderna vaccines, over 3 months for the Johnson & Johnson vaccine being used in the population. And so we know what the potential issues are.
Absolutely. Last question, and we'll get you out of here. What can we do to get more people to trust that the vaccine is safe and to take that step of saying, I'm going to go get vaccinated, if not just for myself and my own personal health, but for the health of our community?
I think for the majority of Black people that I've talked to, it's been a matter of honoring their concerns, answering their questions honestly and truthfully, arming them with the facts, and so that they can make their own decision. I would also say, if you have a family member who's skeptical, don't demean them, don't beat up on them. Be an example. Show them, look, I got vaccinated 6 months ago. I feel fine. Nothing has happened to me. Look at all these people who've been vaccinated. They're fine. Nothing has happened to them. So I think, just understanding what their concerns are and addressing them honestly and forthrightly.
Absolutely. Well, thank you for that. I just want to add a little period on that. 150 million Americans are fully vaccinated. And there has been little to no people reporting any of these crazy disinformation that's out there on the internet in real life. And so just understand that it is very, very safe. And, I've been vaccinated. I haven't had any problem. My family's been vaccinated. No problem. So we do need to share those stories. And so thank you for joining us, Dr. Clark. I know you got to get back to patients and doing what you do. So, but thank you for taking the time out to join us this evening.
Thanks so much for having me, Ellis. Everyone have a great night.
Well, we're going to shift, take a turn and focus on our Gulf Coast area. So that was the kind of the national picture of what we're talking about with COVID and everything. And so now we're going to focus on our Gulf Coast southern states to hear from state health experts on the ground about the impact of the virus to their communities and how vaccine distribution efforts are going. First, from Alabama, we're going to have Dr. Mary G. Mcintyre. Dr. Mcintyre is the Chief Medical Officer for the Alabama Department of Public Health. So I'm going to bring on Dr. Mcintyre because this is a bad woman right here. She is the chief. She's doing it, chief. Doing it.
Good afternoon, everyone. I want to thank you for the introduction, and also for all of those that are on here to actually try to learn more and find out information that will hopefully help. I want to start a little bit with what I consider a little bit of misinformation or disinformation related to differences in some of the numbers and stuff that people are seeing, and really how to interpret what they're seeing. There's a lot of information on the website. We have a data dashboard, and I'm sure the other states that are on here tonight do too. But it's often difficult for people to be able to understand how to read that information and interpret it. I'm going to handle the questions that were given in advance and try to stick to my 8-minute time to make sure. So I'm also watching that to do it. But
you take your time, Dr. McIntyre.
I know, but no. So a lot of stuff we did in Alabama and I told people we got a slow start, but we started right. Okay, what do I mean by that? We really focused early on trying to make sure that we were hitting the population that was most at risk, those that were not just the elderly, but within communities that we know were most disadvantaged. We early on worked to figure out where we needed to go, and we also focused really early on trying to make sure that we were aware of where the areas were that we were most likely to have people who couldn't get to locations and sites, so that we wanted to try to get the vaccines to them. We worked with partners, including the Alabama Conference of Black Mayors, AARP, and others from even before vaccine was available, to make sure that we knew the groups that we needed to try to target. So has the Black community in Alabama been receptive to the vaccine? Well, the older community has been very receptive to the vaccine. And in fact, we all know that we could not keep up with demand early on because the vaccines were, I told people they were coming out in small amounts, and we had lots of people who were really upset because they wanted their vaccines now. And most of those were, of course, the older population. So currently in Alabama, when you look at the population that's 75 plus, we have right at 75% of those people vaccinated. They ran, okay?
Right.
When you look at actually the numbers, and this is where we're having some issues and stuff with people with looking at it. When you look right now at where we are, as states in the southern part, our overall numbers are low, percentage-wise.
Right.
And we are constantly on calls with CMS, HHS, and others telling us additional things we need to do. But the reality is that mistrust, the history, and other things that are impacting the ability to get people to continue to get vaccinated. Early on, they were running, we couldn't keep up. Now we're begging folks to come get a shot and a vaccine, and we're doing everything we can think of, and I'll give you some ideas of that. So as of right now today, when I look at when the actual percentages of African Americans versus the whites that are actually been vaccinated to population, 29.5% white, 28.5% Black, African American. Not a whole lot of difference.
Right.
Now, where the problems and stuff coming in, and this is based on the percentage that we represent within the state. So it's the total population that this percentage is compared to. The other numbers on our dashboard, and I saw that they shared the dashboard, the other numbers on the dashboard actually look at the percentage based on how we fall relatively within the state. So in Alabama, we make up about 26.7% African Americans do of the total population within the state of Alabama. Okay. Mm-hmm. And so right now we are looking at about, from a distribution, about 21.37%. So a ways to go, but not terribly bad. Okay. The overall numbers are bad because as a state, we're only running in the 30% from everybody getting vaccinated. But when I can go and I break it down based on numbers, as people get younger, the percentage vaccinated gets less. Okay. So if you look at people 50 and older, more of them have received the vaccine. And I do that almost every day to see where we are. So when I look at the percentages based on that and that information, we have a long way to go. Now, when I look at ethnicity, even though there's a lot of missing data, believe it or not, in Alabama, even though our Hispanic and Latino population is smaller, percentage-wise, based on their population numbers, more of them have received the vaccine. So 23.3%, not number-wise, but percentage-wise of their population versus 20.1% of non-Hispanic. So when I say we got a slow start, but we got a right start, we have hit the people from the standpoint of race and ethnicity that we needed to get. We have gotten to the people more so that are in the high SVI areas, the ones that don't have transportation, the ones with other issues and problems, including their actual, the economics of it, that may have an inability to take off work and the other things. We have done Saturday weekends and all kind of clinics to try to make sure we were getting population and people that couldn't do that. So many people who have recovered from COVID-19 are asking why they need to get vaccinated. You already heard that. You need to get vaccinated. Well, you didn't hear that, but you need to get vaccinated because we are not really sure how immunity, how long it lasts, or how much you get from getting sick. So when you actually have COVID-19, some people will actually mount more of a response than other people, kind of similar to the vaccine. But with the vaccines, we've been researching and following that. There have been some people that we know and more people who've had COVID-19 and then gotten it again, okay? And not the majority of those folks did not have a variant that created or caused them. Some of them did, but that was the smaller percentage. Okay.
Can I jump in and give a sports analogy on that to help people understand that in terms of why it's better to get vaccinated versus thinking that you're going to be covered if you've had COVID. Think about playing a basketball game. If you go to the basketball court and you just pick up 5 people randomly, you're not going to play as well. You might win, but you're not going to play as well because you don't know them. That's the same thing as if you catch COVID, your body doesn't know what COVID is. So it's replicating in your body, and your body has to learn it and create antibodies at the same time while COVID is multiplying in your body. But if you have the vaccine, it's like going to the basketball court with your 4 best friends. You already know how to play together. Y'all know each other. You're prepared. You're better prepared to play the game. So you're going to play at a higher level because your body has built up the antibodies. So when COVID, and it already knows how to recognize COVID. So when COVID enters the body, if it enters the body, your body says, "Oh, I know what that is," and they take care of it. And that's why you have people with asymptomatic, and they don't even know that they've caught COVID because they've been vaccinated and their body has
That is correct.
That's
so
all right.
It is, and this is the thing, though. It is therefore, even if you've had COVID, okay, it is better to get vaccinated. You need to get vaccinated so that you know that you got specific protection that will be there. Okay. Now, let me say the other thing about that. Some of the people who've had COVID, they may have had a milder case of it, and then, or they may have had a severe, and then they come back and they get it again. And this is not, we've seen people get it a second time and it's been much worse with them. We haven't seen that happen when people have taken the vaccine and then get COVID after the vaccine. Because remember, we said the vaccine is not 100%. So some people still get COVID after taking it. But guess what? The majority of people end up with very mild disease, or they're asymptomatic, where they don't even know they have it. Which is why we still tell people that when you're out and about and you're around other people where you really don't know vaccination status and all of that, continue to do all the things that we know that work. Continue to stay your distance, continue to do all of that. And I'm gonna say this, I know what the CDC has said about being fully vaccinated. I'm fully vaccinated. My husband's fully vaccinated. My grandchildren that are 12 and 13 are. My children are. But guess what? I know that for them, but I don't know that for everybody else.
Right.
Okay? And I'm not just freely going into stores and other places because I don't know. Plus, I'm high risk. Okay. And I am not taking those kind of chances regardless of what people say. And that's what I tell other people. So we've been hearing about homebound people and getting vaccines. One of the things we did right was work on a protocol and process to make sure we reach people in the homes. And then once we freed up from the mass, when we turned directions on what we were doing with mass clinics to focus more within the local communities, to get people in the churches, to go to other locations where people go, so that we were where they were and they didn't have to come to us. Then we were able to free up some of the National Guard, and they worked with the EMA and others to go into people's homes to give vaccines to those who could not and were homebound. We're also vaccinating people who may have access issues from the standpoint of being able to get that. So we've done that. And then about herd immunity, and this is the last thing with one of the pre-questions. We keep hearing over and over again about herd immunity. People ask me over and over again, when are we going to get there? Well, the rate we're going right now, I'm just sorry to say, doesn't look like we will, at least not in Alabama, unless people step up. So we will continue to have to do with the unvaccinated, with making sure that they're wearing and staying their distance. Herd immunity simply means that there are enough people that are immune and have been vaccinated, or immunity, natural. But remember, we don't really know how long natural immunity occurs or how well it's going to work. So you really need to get the vaccine. But those people who that come in contact with a person that's positive, okay, the more people who have immunity, that means the fewer people that can actually get sick and give it to someone else. So let's think that you're in a crowd and there are 10 people, and one person in that crowd actually ends up being sick, but there are 8 people around them that are actually vaccinated, and there's only one person that's not. Okay, that they would have to come in contact with that one person for that one person to take it to spread it to somebody else. Okay, the other people around them can't pick it up and take it to anyone else, or is they're less likely to do that than a person who has not been vaccinated.
Dr.
So that's where we
McIntyre,
are.
can I make one point about herd immunity? And I think what people need to stress is that, and that's why we're doing this in terms of locally, you got to think about it locally, because you might hear the numbers on CNN and see the national numbers, oh, we're at 50% or 49%. That's based on the total population numbers of the United States. States like California, they have achieved like 70% vaccination rates. So they're at closer to herd immunity. But Dr. McIntyre gave you the numbers on Alabama. So while we may reach herd immunity in terms of the United States, because the Northeast is doing a good job in terms of getting vaccinated, Western states are doing a good job, but here in the Southeast and in this Gulf Coast region, they're not. And so we say, oh, we've achieved herd immunity. You got to look at what's happening in Alabama, what's happening in Mississippi, what's happening in your state before you can start saying we're good. And in terms of vaccination. So that's a key point about herd immunity in terms of when we're looking at the numbers. Look at Alabama numbers. If you live in the state, look at your state numbers, look at your city numbers versus looking at the national numbers when it comes to herd immunity.
And we're a long way away from even getting close. I'm just going to say it. When you look at the population, remember I said the ages, when we get to 50, when you go younger than 50, the younger you get, the fewer people that are vaccinated. Okay. That's the problem. So we have got to do better if we don't expect to be where we were last year again. I'm sorry, but I'm saying it. I really don't want to go there, but that's the reality. And especially with children going back into the school system, and a lot of them are not going to be able to be vaccinated. And I'm going to end with this. Children get COVID-19.
They do.
Children get serious complications, and it's not just about preventing or keeping from getting COVID-19. People who survive COVID-19 don't all get back to their baselines. In fact, there are a lot of people with COVID-19 that are struggling. They're having conditions and problems that will impact them probably for the rest of their lives. Some of them were able to work. They can't work anymore. And even children in Alabama, as of the 22nd, we have a total of 12 children that have died from COVID-19. Doesn't seem like a lot. For me, one is too many. Okay. Yeah. And of those, 9 of them were 4 years of age and younger. Wow. 9 of them were 4 years of age and younger. That means they don't qualify at this point in time for vaccination. The older groups, we need to protect the ones who can't get vaccinated. Thank you.
Absolutely. Thank you, Dr. McIntyre. Hang around when we do our final discussion. We'll bring it in. Dr. McIntyre is bringing up an interesting point about, it's called long haulers. And we had on another program, we had an insurance expert talk about you're going to have to list COVID as a pre-existing condition when you go see your healthcare professional. And if you're applying for some sort of life insurance or health insurance, you're going to have to list COVID as a pre-existing condition, and that could affect your premium and your ability to get covered. So you got to think about it in terms of it is a medical illness, not just something like the flu where you can get through it. So I'm going to bring on Dr. Jasmine Chapman. Dr. Owens Chapman, into the broadcast. Dr. Chapman is the CEO of the Jackson Hines Comprehensive Health Center located in Jackson, Mississippi. How are you this evening, Dr. Chapman?
Thank you, and thank you so much for having me on today.
So I got a question for you. What are some of the patients visiting your facility? What are they saying about the virus and the vaccines?
Well, those that have had it, they're saying that it's a miracle. And they feel so relieved and they're so happy to get it. Those who haven't had it and are hesitant, they're saying that the same thing that Dr. Clark and Dr. McIntyre said, that this vaccine was too quickly done. This vaccine is experimental. They are tested this and put in all types of things, like they're tracking us with this vaccine, and that I will wait for other people to get it before I get it, and that I just want to wait and see whether or not I grow horns or whatever. Right. So there's a lot of that's the reason why people are not taking it. But I want to say, just like Dr. McIntyre, when we first started getting the vaccine, of course, it was 65 and older and those with comorbidity. We did something at Jackson Hines. You didn't have to make an appointment. You just showed up. And
Okay.
we would have 300 and 400 people every day that we had the vaccine. And we were able to, even though our numbers are low as far as the total number being vaccinated, when you look at the elderly, the people over 65, we're at about 70%, 70% of those who have had at least their first doses. And so what we saw is that we thought that they would be afraid, but they knew that they had a lot of chronic illness. And that's one thing about Mississippi. You know, we have one of the worst disparity among Blacks and even white Mississippian from other states. So when they realized that I'm at high risk because I'm obese, I have hypertension, I have diabetes, I have asthma, and I've seen people that got it, and they didn't make it. And so they were lining, the elderly Black was lining up, and we just couldn't. At first, we had good partnership with the State Board of Health, and then later the federal government began to send us additional vaccine. And it was only then that they weren't lining up out in our parking lot, because they knew we was able to do it at many locations.
Right.
Jackson Hines have 31 locations, and we were able to do it at any location. And we had 2 mobile units that we were able to take it to the grocery stores or the schools or the colleges or wherever that we were needed. And so so we were real proud of the number of the elderly we got. And at that time, I just want to brag about Mississippi. Mississippi had the highest number of Black elderly to get it around in April of that. So we were very proud of that. And we think it was had a lot to do with federal qualified health centers.
Well, you know, one of the things that I was curious about when we're talking about the state of Mississippi, and kudos to you and the state for getting at least the elderly members vaccinated. There are a lot of rural areas in all 3 of these states. And one of the things when we've had other programs, especially in the South, infrastructure plays a big role. Access to, you know, my own family in South Carolina said my aunt and uncle had to drive an hour and a half to get vaccinated when they wanted to get vaccinated. And not everybody has that ability. How can we address the rural access to vaccination so they don't have to travel so far? And you're talking about 31 locations for your system. How can we get the more rural areas that might want to get vaccinated, but just don't have the ability, the time, or the transportation to go to the centers?
And this is how we did it in Mississippi. There are 21 community health, federally qualified health centers like me. And and we have 309 different locations. Then when you add the rural health clinic that are available, then we were all over the state. Okay. And most of those federal qualified health centers have mobile units. And so we were able to go into the towns that maybe didn't have a physician or we weren't at, and to see those patients. And so that's, I think what was a key for us is when the federal government brought the federal qualified health center into the loop and make sure that we had enough vaccine. And we are and working with partnerships such as the State Board of Health, the colleges, and for instance, Jackson Hines is in every school in Hines County. Okay. We have sites in them. And so it was very easy for us to go and get the teachers vaccinated because we all already had the infrastructure in place.
Absolutely. So last question. What must change in order to get more people vaccinated, to get those numbers up? I know Dr. Mcintyre talked about with Alabama. I know you've got the elderly population pretty much locked down there in Mississippi, but what can we do? But we know there's a problem in terms of as we start getting younger in age, we get fewer and fewer people vaccinated. What can we do? What do you think needs to be done in order to get more people vaccinated?
Well, one thing you have to make it be a difference from those who have been vaccinated and those who are unvaccinated. You have to make them say that it's worthwhile for me to get it because maybe I won't have to wear the mask among vaccinated people. But also you have to do the same thing we did in the beginning. In the beginning, we told the young people, you need to wear the mask, you need to stay the distance, you need to wash your hands, because if you get it, you might not get that sick, but you need to protect the elderly.
Right.
And until we got the vaccine, people were saying, I'm doing this because I want to protect my mom. I want to protect my dad. My grandmother has a lot of comorbidity. I want to protect her. And so they did that. And now we have to tell them, you need to take the vaccine so that you can protect your children. The ones that are not able to get the vaccine now, young mothers, those of you that's 20, 30, and 40 years old, first of all, not just for yourself, because in the Black community, we are family oriented. And sometimes we'll do more for our children and our mom and dad than we will do for ourselves. And so that's what we have to make sure that they know, that now you need to take it to protect your babies. And I think that they will come and begin to do it. And you have to show them, as Dr. Clark and Mcintyre said, you got to have people who have taken it and people who they trust to be the messenger.
Right.
Everybody can't be the messenger with this. It has to be someone that talk their language, that know them, and they trust.
Got you. That's a very important point, especially all throughout the South. I've been hearing that message being repeated over and over again. You can't bring in somebody from the outside. They don't know them. I need somebody that I know and trust, whether it's my pastor, whether it's my own personal doctor, whether it's my friend, my mom, my cousin. I need to hear from them before I'll trust somebody that's coming in from the outside trying to push a vaccine on them. So I definitely understand that. And so we've got to do a better job of making sure we educate and have trusted messengers, especially in our more rural communities. But stick around. We're going to have you back at the end of the program, but we got to move on to our next guest. And she brings up a very important point that I think we definitely want to address, and there's some great questions. So I think there was a question about exercise and vitamin D3 and C and boosting your immune system through a healthy diet, things like that. We'll talk about that when we do our Q&A section. But I want to bring on Dr. Eric Griggs. He is our final regional physician representing the great state of Louisiana. Dr. Griggs is the community medicine director and health educator for Access Health Louisiana, and he has dedicated his professional life to raising health and wellness awareness in the communities across the country. Welcome, Dr. Griggs. You're on mute before you say anything.
I guess that would help, right?
Yeah, there you go. Welcome to the program.
Thank you for having me. Thank you for having me on a panel with such esteemed colleagues and experts. And thank you to everyone that's tuning in. This is truly something that we need to continue. Now's not the time to relax.
Absolutely. So first question for you is, has there been a difference? And I've seen some of the numbers, so I kind of know this, but has there been a difference in how the rural and urban communities in Louisiana accept vaccine information? And if so, what is that difference?
Well, I think Dr. Chapman kind of hit on it earlier. Yes, there has been. A lot of it in the response has to do with access to healthcare. I happen to work at Access Health Louisiana, and it's interesting she brought up FQHCs. Access Health Louisiana, we're at FQHC, 36 clinics across the state, 47,000, 50,000 people across the state. But it's interesting because, again, it has to do with trust. It has to do with access to care. And at the bottom and the root of all of this, besides the distrust, is health literacy. And I don't mean just word identification. Just because I know what COVID means, if I don't say COVID and I use SARS, CoV-2 instead of COVID, you lost thousands of people. You know what I mean?
Right.
Yeah, so there's been a big difference. There's been a lot more concentrated efforts in our urban areas. We've worked together with in the community, meeting people where they are. We've attempted to do it across the state. We worked with the State Department of Health. One of the good things that's come out of this, besides new vaccine technology, is collaboration. There are a lot of groups, community health organizations, even city health departments, state health departments that were operating in virtual silos, that because of the seriousness of this, we've all started working together, and we are able to get the word out. The big problem, and I know we'll get to it later, is in Louisiana that a lot of this got politicized, just like it did across the rest of the country. So It's turned into more of a statement of political principle than actual science. At one point, it feels really good to breathe easy now, because last year, we doctors, we scientists were the bad guys, and we didn't do nothing wrong. All we did was go to school and try to help out, and everybody hated us, and they didn't believe what we were saying. At least the science is the science, and now we're having to just repeat ourselves.
Right. So how can you describe how the pandemic has exacerbated kind of social inequities? I've seen it all over the country, but specifically in the state of Louisiana.
Well, let's start here. There was a myth going around in the African American community at the very beginning that Black people don't get COVID. And it was a joke. It was in the barbershop. Man, I wish I would give me some COVID. COVID ain't nothing but the flu. That's not the case. As we found out very, 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 very vividly, I've lost 14 people in the last 15 months to COVID-19. I've been since March 13th, 2020. It's 18 hours a day, all day, every day. COVID. It's my life. So what happened in our community is the mistrust that was already there due to the history that was alluded to earlier, was the Band-Aid was ripped off. It was totally exacerbated. It was our governor that actually went on television in April and said that 7 out of 10 bodies that were in the morgue due to COVID-19 in Louisiana were African American. That miss and that disinformation. Again, it's been referred to as a 9,000-pound animal called social media didn't help us at all. But those access issues and those barriers to access and the inequity issues turned into reasons and excuses not to go get tested and now not to get vaccinated. So everything is it's all on the floor. It's all on the table. We got an elephant in the middle of the room. We're either going to eat it or it's going to run over us.
Absolutely. So let's say like somebody gets vaccinated. Is it safe to travel? Is it safe to have family gatherings? People want to be able to return to life. And they said, okay, look, Dr. Griggs, if I go get vaccinated, will I be able to go back to my life that I had in 2019 pre-COVID? Will I be able to go back?
So what I want people to accept, first of all, let's deal with the fact that we might be finished with the virus, but the virus is not finished with us. It's the nature of viruses to mutate. They're doing what they can. All they're trying to do is get in and pass on their genes, and they can't live unless they get inside of us. So go ahead and get vaccinated. We know that vaccines are effective. We know that vaccines, especially after your 2 weeks, after your second dose or after the 1 dose, 2 weeks after the 1 dose, you're considered fully vaccinated, right? It doesn't make sense to it's not like our eyes turn green or yellow or red or blink and flash blue and green because we're vaccinated. I can't say that I was Eric and I was Annie Mae's baby boy, her grandbaby, before I was Dr. Griggs. And she told me to use mother wit or common sense. If I don't know that everyone around me has been vaccinated, I don't need to be going in large crowds. There's still a small chance that I could contract. There's still a small chance that I could transmit. There's still a large chance that a lot of people, first of all, we talk about the honor system. I'm just going to be honest. Some people are lying. Have you been vaccinated? Yeah, I was vaccinated. Man, were you vaccinated? No, I just really want to go. So the thing is to use common sense. The question about should you travel? International travel, we know, is dangerous. And it's travel that actually kind of got us in this conundrum, this situation that we're in now. There's a difference between, we talk about herd immunity. It's not like a light switch. It's not like, we hit 70, 80%, bing, everything's normal. I don't think we'll ever, I agree with, I think it was Dr. Chapman said it wasn't Dr. Chapman. I agree that I don't think we'll ever reach herd immunity. And that's fine. We're going to be dealing with hotspots. We're going to move from being a pandemic, which is a worldwide virus situation, to being endemic. An endemic is something that's localized to a particular region. If COVID is going to be around, it's going to be something that we have to deal with. If this virus were endemic in the very beginning and people didn't travel all over the place, masked or unmasked, lying about their vaccine cards nowadays moving forward, if they didn't do that, we wouldn't have the risk of transmission worldwide. The Delta virus, what's going on in the world is a threat to us all, unless we all protect ourselves and we take this thing seriously. If you're going to get with family, make sure that everyone's vaccinated. If you have to do it preferably, do it outside where it's well ventilated. If you're going to travel, make sure you find out what the numbers are going and the numbers are where you're leaving from to know your status. International travel is still discouraged because we're not out of the woods yet. The virus is still mutating. We have Delta, and now there's Delta Plus. I have to do a story on tomorrow morning on the news. So again, viruses mutate. You want to be careful. Use common sense and be careful. And I would not be, I said I was Annie Mae's baby's first. I would not be my grandmother's child if I were a doctor and sat up here and told you not to wash your hands. Please keep washing your hands. Please keep wearing a mask. The numbers for the flu around the country are virtually zero. It was a big nothing. And part of it was due to vaccines, but also it was due to wearing a mask. Yeah. And don't be not going around people when you're sick. Just common sense. The books and the numbers are in the books. The brain is up here. Use that to dictate your actions.
So you make a good point. And now you talk about Delta Plus, and that's not an upgraded seat on your plane. Okay?
No, there's no sky room with this.
It's not like that. So last question for you, Dr. Griggs, is what must we do to get more people vaccinated? I think, I think we're all in agreement because every state is talking about how well they've done with the older members of the population, but we're not doing so well in the younger members. And I remember I was doing another program, and when I was talking to some younger people in their 20s, and I said, how many of you know somebody that's had COVID and survived? And all of them raised their hand. How many of you all know somebody that's had COVID and died? And none of them raised their hand. They're looking at their peer groups and saying, oh, I can survive it. Why do I need to get vaccinated? Whereas older members might be looking at their peer group. My mother knows somebody that's died as a result of COVID. We had a doctor on the program last night. Her mother died as a result of COVID. So it's more real to an older population than it is to younger. How do we get the younger people to recognize the realness of this?
Again, I want to emphasize, have lost 14 people to COVID in my social circle. Fortunately, no family members, but unfortunately, people that were like family to me. And they vary in age. We have some that were in the 60s and one was in his 30s. The issue is we need to be intentional and consistent with our messaging. COVID isn't over, and neither is our fight, and neither is the messaging. It's now time for, you try to do it. I have a 22-year-old. You try to be as hands-off as possible, but it's now time for the elders, like we would say in the church, to stand up and get up, go get your shot. Go get the shot. Seriously, let me deal with all the reasons why that you don't want to get the shot. I'm going to inundate you with facts. I'm going to inundate you with the facts. I'm going to give you everything, answer every question you want to know. Now go get vaccinated, because until this thing, if indeed there's potentially another wave, a third or fourth, I don't even know which wave we're on at this point, in the fall, things will get more restrictive. If you're not vaccinated, you give them the message of social responsibility, community responsibility. Just because you don't know, you go back, exactly, it was brought up earlier, go back to the original messaging. Just because you feel fine doesn't mean that you're not sick and that you can't pass that sickness on to someone in your family. It's not just young people. I'm telling you, man, people be lying. I know some older people that lied and said they got their vaccine, and then after people leave, I'm like, you didn't get your shot, did you? They're like, no, not yet, doc. What you waiting on? 320 million, what you want? So we just have to be intentional, consistent. We have to, if you want to know how to effectively message to a younger generation, we have to pull them into the conversation. Ask them, what would work? And just like we were talking about empowering our pastors and our community leaders, we need to start empowering our youth and those young folks with the message. Give them the data, make them the expert. And then you have standing in the background with your biting your bottom lip, and you got to get your shot.
Absolutely. We're going to bring them into the conversation, but look.
Right.
Boy,
look, give me the car keys. Give me the keys right now.
Absolutely. Well, we're gonna we're going to take a pause there. We're going to bring you back when we do our panel discussion at the end, but I want to bring back, this was a great discussion. I'm going to bring back John Kane from the AARP. This has been a wonderful conversation. I'm just going to say this before I ask you the first question. I am fully encouraged by what is happening in Mississippi, Alabama, and Louisiana, knowing that those three people are on the ground, boots on the ground, fighting for our lives in those states. I am more encouraged about what's happening, even though the numbers might be low. I know that there are good people on the ground making sure that Black people, whether they're elderly or not, are getting the information that they need in order to try to remain safe and get through this pandemic. So let me say that as a statement. So we're welcoming back John Kane. He is the Regional Vice President for AARP. He did our welcome earlier this evening. If you're just joining us, if you missed the beginning, he did our welcome. So my first question for you, Mr. Kane, is what is the one thing you want our audience to know about what they could be doing to get the information they need to make a vaccine decision?
Well, you mentioned when I made my opening remarks, I share some statistics.
Yeah.
And I talked about how serious it is for the African-American Black community. Mm-hmm. But there's also some good news. And you've heard some of that good news from the health professionals that preceded me. Organizations like blackdoctors.org and AARP, what we're doing is providing real, factual, straight up information. AARP is engaged not only with members, with the 50+ population and their families. We concentrate in the South, and we're talking specifically tonight about Alabama, Mississippi, and Louisiana, but across the AARP enterprise, AARP is partnering with our volunteers who are the faces and voices of AARP and our staff in all the states. And we are talking to folks, listening to folks, doing teletown halls, doing Facebook Live. We're giving people opportunities to talk to professionals like you've heard tonight. And AARP wants to be your partner. AARP wants to give you information so you can choose what is best for you and your family.
Absolutely. And we've got for those that are watching us now, that's the website to go to. That's scrolling across the bottom of your screen. I know there are some numbers because sometimes people aren't as internet savvy. We get it, we understand it. And so I know there's some representatives from each one of those states are here. So if you want to put the phone number in the comment section, we will get that displayed on the screen as well, because we want to make sure that people can go to the AARP and get the information that they need. So you did we've heard throughout the night that older adults statistically are doing better in terms of getting vaccinated. How can vaccinated older adults, and I know Dr. Griggs had some old school methodology in terms of employing, getting younger people vaccinated. But what are your thoughts in terms of how can we get the younger people, younger folks, younger adults vaccinated?
And some of that was touched on tonight. I think about my family.
Right.
I think about my daughter and her husband who've gifted us with a grandson, and he's 3 years old. And I think about the fact that they are vaccinated when he is not. And so they're not only looking after themselves, they're looking after their children. I think about my wife and I think about my son. We're vaccinated, so we as a family group can get together and we can have movie nights and we can get together and go on vacation together, all in a little hub. Mm-hmm. And I think about all of us across this United States and all of us throughout the South region. Think about yourself, think about your family, and think about others. So one of the reasons to get vaccinated is not just for yourself, but for others. And one thing you can do is just transfer knowledge. Let folks know that you've got vaccinated. Let folks know how to get vaccinated, where to get vaccinated, and more importantly, help them get the advice and information from trusted professionals like you're hearing tonight.
Absolutely. I think, and that kind of leads to our next question. My next question is in terms of what is different about the South, right? Because, I grew up in the South, Florida boy, families from South Carolina. I understand we've got different sensibilities in the South. And so what is different about the South that makes it harder to convince some Black residents to get vaccinated? Is it?
Yeah, well, I'm a product of Jacksonville, Florida.
Oh,
You know, hey,
homeboy, that's where I'm from.
we'll talk later. I'm Reball Senior High. But anyway, we'll talk later. We'll talk later. But I can tell you, and some of that was touched on by some of the healthcare professionals tonight. In the South, we know that there has been disinformation. Mm-hmm. We know that we have challenges when it comes to relationships with trusted healthcare providers or finding trusted healthcare providers. So I can tell you here in the South, we don't move slow, we're moving cautiously.
Amen.
And I can tell you that because of that caution, that's why folks who are listening to this tonight can glean this good information, transfer that knowledge to others who are not listening tonight. Help them get in touch with AARP, blackdoctors.org, their local healthcare provider, their faith-based leaders, community leaders. The thing that's different in the South is trust.
Yeah.
And I ask you to go to those that you trust. Now, I heard you earlier talking about what's going on in the barbershop. I get my hair cut every 2 weeks. I don't trust everything in the barbershop. So when I want to get some real information, I talk to AARP.
Amen on that. Amen on that. There's some great sports conversation in the barbershop, but I may not get my medical information from the barbershop.
You got that right. I go for a good cut and a laugh.
I haven't been to the barbershop in a long time, but I still go. I take my son, and I engage when I take him. So, final question: shed some light on all the program. What is AARP doing? Because I noticed that when I go to your site, I can pick my state and find out specifically what's happening on. So talk to us more about what AARP and how can people lean into those AARP resources to get the best, most current, most factual information so they can make a informed vaccine decision.
Well, and you just said it. AARP is already in the community. We've always been in the community and we'll remain in the community. What we've done over this pandemic period of time, we've upped our game virtually. We've upped our game as far as building relationships with organizations you represent. We've upped our game as far as making sure that virtually folks can get information that's honest, that's real, and that's factual. AARP is there in your state, whether you're in Louisiana, Mississippi, Alabama, Kentucky, Florida, you name it. We're there.
Right.
Contact AARP. Be on the lookout for the AARP individual websites in your state. You can get free information, you can get factual information, and we're there to connect you. I can tell you, like in places, AARP is partnering with an organization called 211 in Alabama.
Okay.
And basically you call 211 and you get information. You get information about where you can go to get a ride to get a vaccine. You get information about where to go to get more information. Our folks in Alabama, and I'm so proud of the many, many volunteers who are with AARP day and night, providing services and providing good information. So it's there. It's there. Contact AARP, become a volunteer with AARP, and we're there to work with you.
Well, I will say this as we're bringing back the other guests, that go to that website. If you have a computer, if you have access to a computer, go to the website, aarp.org/coronavirus. You can search for your state. So even if you're not from Alabama, Mississippi, or Louisiana, you can search for your particular state and find out what AARP and find resources in your state from the AARP. But
absolutely, we got you.
Tonight, is everybody back? Okay, we got everybody back. So I'm going to throw this out to, we'll start with you, Dr. Mcintyre, because I saw that Alabama's doing some unique things in terms of trying to get younger generations vaccinated. So I want you to talk a little bit about that. I'm glad you put it. So, because I want you to talk about that so we can talk about what we're doing to get younger people vaccinated.
The reality is I do some of my best work when I'm asleep. I have dreams. This stuff bothers me all the time. And one of this is the thing to do a TikTok contest where we allow the young people to actually that are taking the vaccine to actually tell people why they took it, and to do something creative with TikTok. So we're working on that. It's slower than I wanted. The group that we're working with, I said, where is it? I needed it last month, and they promised me they're gonna help get the rules out and all of that online so we can get it done. The other thing that we've done with young people is we're working with the historically Black colleges and universities, and we've done a number of vaccination sites there. But what we're also doing with them is we tried out stuff like the food trucks and the gift cards, trying to get people involved, because we're trying everything we can to try to get more young people to actually do that. So there's actually a block party, and I'm gonna tell you, we're working with partners and communities, and we are listening to what they say. We're trying to tell them how to do stuff safely if they decide they're going to do something. So there's actually a block party being held in Union Springs, which is one of our predominantly Black and really economically depressed communities that should be happening not this weekend. Wait a minute, what's the date? Yeah, it is this weekend. And so they're going to be doing food. They're going to give stuff away like to the first 200 young people age 12 to, and I can't remember the thing, but it's to a certain level age group. There's also a potential for them to win $1,000 for being there. This is not the state. This is the state working with other folks. Okay. And so we've been doing a lot of that to try to figure out what we can do to try to get other people involved in making sure that we reach this population. So hopefully this will work. We'll see. Okay.
So TikTok, that's smart, because that's where my kids, they're always on TikTok. They don't use any other social media, but they are always scrolling through TikTok. So if we got to go there to find them and get them, then let's do it. There has been, and this is either for Dr. Chapman or Dr. Griggs or both. There's been several comments about on the negative side in terms of they don't want to get vaccinated. They just said, eat right, exercise, take your vitamin C, take your vitamin D3, and you'll be fine. They don't need a vaccine to get through this pandemic or to help them get through this pandemic. What do you say to those folks?
So my first, and I'm sure Dr. Chapman will be more scientific, but do you? This is a free country. My job is to give you the information and to stay up all night reading it as it comes out and to give it to you straight. But look, player, if that's what you want to do, go exercise. I need you to exercise anyway. I need you to vitamin D3, vitamin C. Matter of fact, why don't you eat a healthy diet and color up your plate with vegetables, watch your portion size, go out and exercise and do all of that, and make sure to get sleep, because growth hormone is present when you get your REM sleep. That's when it comes out, and that's when you get your repair. However, if you should ever, like everyone, but when this first started, I was trying to explain to people the difference between a mild case of COVID versus a moderate case. A moderate case of COVID-19 is when you have to be in the hospitalized, usually for needing oxygen, right? Everyone on this call, I'm pretty sure, has had the flu at some point, right? And I'm sure everyone on this call, because of they've had that flu, does not miss the flu shot. So if you think that you can weather the COVID storm after knowing what I know and seeing what I've seen and all these collective hours that we've seen on this call, do you, player? Good. All right. We'll be here. See me now and see me later. Take your shot. I'm going to love you anyway. That's the reality. Dr. Chapman, I'm sure will be more scientific, but
No, I'm going to leave it alone. I think you did a great job. I don't need to say anything about that. But I want to go to Mr. Kane, what he said about the barbershop. Now, I'm going to tell you, you must not be in Mississippi. That's where you get your news. And so what we did at Jackson Hines, we got a group of barbershops, hair salons, people that do exercise, all type of people. They're part of IT. We have taught them healthcare issues and how to about COVID and the need for the vaccination, and they're incentivized because we are giving them a little bit for their time because they're entrepreneurs and they can't do this for free, but they are making a significant difference with the people they come in contact. And we'll find that when they say, look, I like Dr. Griggs said, man, I got mine, you need to get yours, and this and that. The people listen to them better than they do to me. And the second thing is, I'm going to do some bragging. We had Dr. Jill Biden down here. Okay. Because of a relationship that we have with Jackson State University. We go there every week and do vaccination. And we do let the people, the young people, help us convince each other that they need it. So we are very pleased with both of those activities.
And Dr. Chapman, I'm going to say I agree with you 100%. The president has an initiative. I live in Atlanta, Georgia. You know we do hair in Atlanta, Georgia. And so there are barbershops and salons all over, professionals who are providing great information.
That's
I'm
right.
talking about my barbershop. I'm talking about the industry as a whole. I know the guys at my barbershop as a whole. The industry is a great place to get good information. It's all seriousness. There's an initiative like in your state and other states where folks are providing good information and resources for others to get good information. So I applaud that industry. Don't forget, I live in Atlanta, Georgia.
Oh yeah. There's some hair shops here in Atlanta. I'm back there for that. I'm an Atlanta resident myself. So and that program by the president is called Shots in the Shop or Shots at the Shop. And they have a wonderful incentive program. You can Google that and find all about. So if you are a barbershop owner, you can apply to get a grant to basically to what Dr. Chapman is talking about. They're doing a nationwide program with barbershops because they understand that is a source where a lot of people discuss and really share ideas and information at the beauty salon and at the barbershop. So, Dr.
May I just do a shout out? The person that the group that funded us was United Healthcare, and I just want to do a shout out to them.
Okay. So there was a question. I'm going to throw this to you, Dr. Mcintyre, about there has been some research that has shown that there has been some heart inflammation, mild. Was it myocardial? It's too big for me, but
Myocarditis.
Myocarditis. There you go.
And pericarditis. I wanted to address that because I did see
associated with the vaccine. Yes,
I did see it associated with the vaccine. Let me tell people this. I said, yes, very rare cases, but guess what? There's more associated with COVID-19 infection. Okay. And this is what people don't understand. Yes, there have been some side effects, some of them severe from the vaccines, but a whole lot more side effects from the disease, more long-term complications from the disease. And I tell people, if you're looking at doing, when you line up stuff on a paper and you say, okay, here are the risks versus the benefits, the vaccine will succeed any and every day based on getting the disease. I know too many people that survived. I also know a lot of people who didn't survive, but a lot of the folks I know that survived are not back to where they started before they ended up with COVID.
Right.
They're dragging around an O2 tank. I'm gonna say it, and this is one of my employees dragging around an O2 tank. Okay, was out for 6 months. Okay. Now, people need to understand that, yes, there are side effects. The myocarditis, very rare. Nobody has died from the myocarditis that associated with vaccines, but people have, for the most part, actually improved without any treatment having to be given. And that's associated with vaccine. We know how many people have died from COVID. Okay. So think about it. Just if you had a scale and you were doing a balance, that is exactly what you would be looking at. Okay. I will take and I told people, I said, yes, I had complications or side effects with the second one. I knew potentially that there could be side effects, but guess what? If they came up again and told me tomorrow that I needed to take a booster for it, I will break my neck to be first in line to get there, because I have had flu and almost died. Okay. So I do the same thing with the flu vaccine. I missed it one time and I promised myself never again would I not get it, because it was the year they gave out and I was too slow. So I'm never going to be that person again. So I actually was one of the first to take the COVID-19 vaccine in state, because I took it with the governor. Okay. I was running to get the vaccine. So I tell people, if you want to make sure you have a better chance of surviving anything, go get vaccinated, please.
Right, right. And I just want to add some context to that heart inflammation issue. Even though I can't say the word, I did read the research, some of the research, and what it does of Dr. Mcintyre is absolutely right. The people that did report it, their heart did go back down. It didn't last very long, and it was a natural thing. People that had COVID, it lasted longer, much longer, and it had a heart effect, especially on athletes. And I know a lot of Black people play sports, and it had a higher effect in terms of that. Had athletes that had COVID had enlarged hearts at a higher rate than an average athlete. And so they're more, basically there's more deleterious effects for having COVID than having the vaccine. The vaccine is not perfect, we understand that, but it is a better chance. Like you said, if you put that list down, you could put at the top of the list, over 600,000 people have died from having COVID. And that would stop my list right there. But if you want to put more in terms of health, brain fog, migraines, rashes, heart complications, there's the list goes on kidney complications. The list goes on and on in terms of what is associated with getting COVID. Dr. Griggs.
Ellis, I just want to add something here. Not that there's anything to be added, but this hits on a real point, right? Things are a lot. Your anxiety levels go down when you fully understand everything. Now, my grandma used to talk about that itis all the time. Itis simply means inflammation. That means something is going on somewhere in your body that more cells or more something needs to get to that tissue, so it swells up. And in certain instances, things go down. Myocarditis. Myo is muscle. Cardio is heart. You got inflammation of the heart muscle. The immune response, part of the inflammation is part of your immune response. And you want it controlled in a vaccine as opposed to COVID, where you can have a cytokine storm. You don't know what's going to happen. So The point is, just like what I really appreciate about what you did was you yielded to the people that have more experience in that area. It doesn't mean that you're not intelligent, because you're brilliant. It's just that, I don't know, you ask me to change my own oil in my car and watch what I do. Watch how fast I throw them keys at you and a whole pile of money. Man, do that. I don't know what that is. When you're reading, when you're talking to Dr. Google on the phone, when you're reading from Dr. Google, Google, you're reading that and getting your Google medical school doctorate. Make sure to talk to a true scientist or professional about, look up, like your mom, your parents, you'd ask them how to spell a word, they tell you to look it up. How am I look it up? I don't know how to spell it. How are you going to make come to a conclusion and go to the barbershop, go to Mr. John Kane's barbershop and tell people about your new Google doctorate and this new information if you don't know what it means? Take the opportunity for things like this. This is amazing. AARP, blackdoctor.org. You have professionals. We've spent 25, 30 plus years reading this stuff. Sometimes since we were little kids. I knew what myocarditis was before I knew all my states. You know what I mean? Like, talk to someone that you trust to decipher. If you want to be an expert, let us make you an expert. Take advantage of those programs like the shots at the shot and all the other things that are being done to empower people in the community. But don't draw your own conclusions. Have people putting blow dries up their nose and don't do all that. Stop that. I'm not telling you what I heard. I'm telling you what I went through.
Yeah, this has been a wonderful, wonderful forum. I could talk to you all night. This has been wonderful. Thank you. I want to say thank you to our partnership with AARP. Thank you. This has been phenomenal. and as we're wrapping up, because I know we're over the time, we were supposed to be here for an hour, but information, there's no limit on time limit on information, on quality information, on quality discussion. And so I was willing to go over the time that was allotted to us so we can get people the information that they need so they can make an informed decision. So thank you all for staying with us. I will say this as we're wrapping up, is that I want to take a final opportunity to thank all of our guests and panelists this evening for their dedication to combating COVID-19. Again, we want to thank the AARP for their partnership in bringing this broadcast to their community. We understand that progress has been made, but we still have a way to go. We encourage all to continue to educate yourselves and your family with facts about COVID-19 and the vaccines so you can make an informed decision. We at Black Doctor will continue to provide this information and forums through programs like this, our relationship with the Black Coalition Against COVID-19, and our COVID-19 Resource Center on our website at blackdoctor.org. Until we come out of this pandemic, please continue to stay safe by wearing a mask, washing your hands, and watching your distance. Thank you so much for joining us this evening, and y'all have a blessed night.
Thank you.
Thank you.
Bye.